So I'm just going to mention a few things on the advocacy arena to finalize this thing. So we worked with the World Health Organization to ultimately win a global treaty that was phasing out all mercury measuring devices from healthcare by 2020. We started with one hospital in Boston about 20 years ago. And what was interesting about the treaty that was passed is that it was the fact that the healthcare sector had figured out how to do it, that they had within their own infrastructure and institutions figured out how to phase out mercury, gave sort of political weight to the fact that, well, other sectors should be able to do it as well. And so what we're trying to do now is to pivot, and having built this whole global network of hospitals and health systems and health associations focused on the environmental toxin mercury, to pivot that same group of institutions to say, well, climate change is the next thing we need to do. We need to validate the transition within our own institutions and then advocate for treaties and policies that are actually going to phase out fossil fuels. It turns out that actually the leading source of mercury emissions is coal-fired power plants. So there's sort of a normal transition. Within the President's Climate Action Plan, obviously he himself, Obama and the administration has pivoted, and you heard it from the EPA today, is that the way that they've understood about how to frame a lot of their policies is to talk about health, to talk about how many thousands of asthma cases are going to be prevented by the Clean Power Plant, how much we're going to save on healthcare costs. So everybody is realizing that health is the most powerful frame in which to talk about climate change. In the President's Climate Action Plan specifically, it calls out the importance of creating more resilient and sustainable hospitals as a core plank in the plan. Robin didn't mention this, but she is the author of that document, Primary Protection, which talks about all the specific strategies that the healthcare institutions around the country can do to design in climate change into their operations. And there's a whole set of checklists and case studies, and it's all available at that website. So it's a very actionable how-to guide. We released this climate resilience toolkit at a White House event with a bunch of large hospital systems in December with the President's leaders in HHS, and EPA and others. And more and more, and this event is part of it, is getting those leaders to step out around climate change. What we've done is created a healthcare climate council that has 15 of the largest healthcare systems in the country, all now working together to begin to express their leadership around climate change. As one example, I'll mention, is that now there's about 7 different large hospital systems in the country that are offering discounted solar installations to their employees for their homes. Other hospitals are co-investing, as Robin spoke about, like in Wisconsin, they're co-investing for renewable energy, more distributed energy in the communities they serve, understanding that they're the economic anchors. They're not just the healthcare providers. They're in 200 cities in America, they are the leading employers. So they have this very special role to play. And then last thing I'll mention, I mentioned it before, but getting health associations, hospitals, health foundations, organizations that have health as their mission to divest from fossil fuels is an important piece of this puzzle, because we want to remove the social license of industries that are contributing to damaging the health of billions of people. It's at a biblical scale. And so if we're about health, fundamentally, if we're about health and the health of our communities and the health of the planet, we have no business investing in fossil fuels. That's fundamental. And so we are inviting other health associations, other health organizations to divest whatever holdings they have. Healthcare Without Harm and Practice Green Health have done it. It would be great in the same way that so many other institutions did around tobacco, that did around apartheid around the world, to take away the social license of these companies. It would be very powerful for other health organizations to do so. So I think we'll stop and take some questions from folks or comments. Thank you very much.